Okay, good afternoon. Glad that everybody decided to stick around. It's worth it. Okay, so I'm going to give my talk this afternoon is going to be on dietary intervention and exercise and aging, and really focus on some of the work that we've done in my lab at the University of Central Florida, with the work that the research team has put together. The primary goal when we take a look at ways of interventions that we can increase muscle mass and try to reduce the risk for sarcopenia is actually looking at ways of nutrient and exercise interventions to offset this disease. As discussed a bit earlier and by probably several speakers today regarding the cycle of frailty, it's a pretty nasty situation as one ages and you don't take care of yourself. If you get to be 70 years old and in the 78th decade of life, it's probably a little bit too late. That doesn't mean you can't stop, but when you need to start thinking about about older age and much younger in your 5th or 6th decade and continue that. It's been a goal of mine since I turned 50 to still bench press 300 pounds every year. I'm so far successful in that, but it's a whole lot less than I used to bench. But it's one of those goals that I've set for myself. I'm not very good at convincing others older than me to do that, but there's a few people that do that, and we do know that if you're not able to maintain appropriate nutrition and appropriate exercise habits as you age, this cycle of frailty becomes very serious and does tend to have significant effects on your morbidity. So one of the things that we're going to really focus on is the impact that resistance training, protein intake, dietary supplementation, with specific emphasis on dietary supplementation, has on affecting reducing the risk of falling, improving mobility as one ages, restoring activities of daily living, results in less visits to the physician, promoting a healthy life. So when you're speaking with clients or you're working with individuals, the question is, are you promoting appropriate exercise and proper exercise? And these are some of the factors that all go into enhancing protein synthesis. Dietary protein, what you get from your normal diet, exercise, a potent stimulator for protein synthesis, and supplements, when needed, can be a helpful adjunct of enhancing protein synthesis in the body. On the other hand, one of the more common issues related to aging is malnutrition. As one ages, the ability to consume a sufficient amount of calories becomes reduced. Also, the ability to consume a sufficient number of grams of protein becomes reduced as well. And obviously, inactivity has a huge effect, as well as any sort of comorbid illnesses or diseases, all result in protein degradation, reducing muscle mass. So we have this balance that we're looking at, this protein synthesis versus protein breakdown. Are we creating a positive anabolic environment, causing increases in protein synthesis, or are we attenuating lean mass, increasing protein degradation, resulting in muscle loss? So the benefits of exercise on sarcopenia would, as you can see from this slide here, taking a look at the age on the X column, looking at the ages from 10 to 80, if we continue to train as we become older, the ability of an 80-year-old individual to train will give them the equivalent ability of a 50-year-old person who's sedentary. And that becomes extremely important, that the benefit of exercise allows us to improve the quality of life as one ages. We decrease the rate of physiological changes as one ages if we continue with an exercise training program. We assist in maintaining independence as one ages through an appropriately designed exercise program, and we reduce the risk of chronic diseases that are associated with inactivity. In essence, we're improving the quality of life. The most anabolic thing that you can do besides taking anabolic drugs is resistance training. Resistance training is a potent has a potent anabolic effect, and is the most effective countermeasure to skeletal muscle loss with aging. The long-term benefits associated with resistance training of improving strength, power, and endurance exercise, we can increase strength, improve neurological benefits, and improve aerobic function as well, and especially in individuals who are 60 years of age or older. In a meta-analysis of 121 studies examining resistance training in older adults, Mangina and his colleagues suggest that a properly prescribed resistance training program will slow the loss of muscle and bone, improve strength and functional capacity, increase activities of daily living, decrease disability risk, increase cognitive function, and recent evidence has suggested that muscle power is an important determinant of functional capacity. In fact, lifelong resistance training may attenuate as much as 20 years of muscle power and strength decline. So one who continues to train and training for muscle power at the age of 85 would have the equivalent functional ability as a 65-year-old. This is taking a look at a meta-analysis of looking at muscle power in middle-aged and older adults. And this forest plot indicating the beneficial effects of resistance training and the effect of power performance. And one of the most interesting things here is that the resulting of this study, the authors concluded that power training is more effective than traditional resistance training for improving muscle power. And this becomes important because as we consider the inclusion of resistance training programs in the training programs of older adults, we generally take a look at high volume training. But as we begin to progress, the utilization of different types of exercises that emphasize power or different loading schemes may prove to be more beneficial in improving muscular power, which may be more beneficial for functional performance in these older adults.
Can you say the difference?
Between muscle power and strength?
And resistance.
Power training and resistance training.
The power training is generally using a component of a velocity component using high intensity training, higher load, less repetitions. The traditional resistance training is using more of a slow velocity movement, perhaps doing 8 to 10 repetitions, higher volume sort of training of 8 to 10. So when we use more power training, we're actually using more explosive type of exercise, explosive type of movements for the older adults. It's a way that we can progress. It's not something that we're going to go out and do power cleans with 80-year-old individuals, but we're going to use a progression model where we begin with more of the traditional resistance exercises and then progress to more of the explosive lifts, or at least the way that the loading scheme that we're going to use. I don't think we should be afraid to progressively increase the resistance in older adults. The benefits of using high resistance, if it's appropriate for that particular individual, can be seen by enhancing power performance, which has a greater effect on functional performance.
Injuries in power training?
If they're appropriately, again, the progression, the key is the progression. How we progress the individuals from a traditional resistance training program through a more of a power type training program, sort of a linear type periodized training program, as you move from a preparatory hypertrophy, higher volume phase of training to the higher intensity strength power phases of training. No different than we do with an athlete. Obviously, the training program would be quite different, but in terms of the progression, we prepare the individual by going through higher volume, less complicated exercises and progressing to more complicated, higher intensity exercises as we go through the training program. But the important thing to keep in mind is that the benefits of progression even in older adults, are still seen by improvements in functional performance. So I want to discuss now some of the work that we've done, and here you take a look at the picture of the team that we have at University of Central Florida Institute of Exercise Physiology and Wellness. This is this year's team, and obviously we change it up. We fund 15 students, 2 postdocs, we have about 6 faculty associated with the institute. One of the bigger studies that we did in the last few years, and you'll see a number of studies that came off this study, was looking at a resistance training program in individuals who were part of a life group on campus. Everybody was in the age of 70 or above. We recruited subjects in a relatively small study. 13 subjects were randomized into a resistance training group. 13 subjects were randomized into the control group, where we performed typical health questionnaires, baseline DEXA, ultrasound measures, familiarized with the resistance training program. And the group that did the resistance training program, we also tested 1RM on a leg extension exercise, and we did 6 weeks of training. And then at the end of the 6 weeks of training, we did the post-test and all the variables discussed. This is what the workout training program looked like. It's 2 days a week for 6 weeks. A full body workout, squats, push-ups off the wall or blocks, leg extension, shoulder press. We use the whole body workout, as you can see, 2 days per week. Anthropometric measures before and after training, no significant differences were seen in the groups in any of these anthropometric measures. We looked at muscle quality using ultrasound. We found that to be more beneficial than DEXA. We looked at cross-sectional area, muscle thickness, and echo intensity. This is some of the data that was published by one of our doctoral students, Scanlon, in Muscle Nerve in 2014, taking a look at 1RM knee extension, muscle quality, which was measured by the 1RM divided by lean thigh mass, and as well as the relative echo intensity. Significant interactions were seen between the groups in maximal strength and leg extension. Significant differences were seen in the group that resistance trained, and these differences were significantly greater than the control group. We saw similar responses in muscle quality as well as in the relative echo intensity. Echo intensity is a measure that is used to describe the quality of the muscle using ultrasound assessments. Further examining the muscle architecture, we showed significant differences only in the vastus lateralis cross-sectional area, significant interaction between the groups. No other differences were seen between the groups in any other measure. Rectus femoris muscle thickness, rectus femoris cross-sectional area, the vastus lateralis muscle thickness, or in lean thigh mass. But cross-sectional area of the vastus lateralis was significantly greater in the group that performed the 6 weeks resistance training compared to the group that the control group. And just another figure taking a look at those effects from the group that did the resistance training versus the control group. This was significantly different. Yeah. Left. Ooh. Okay, I'm already at 60. I'm going to go warp speed now. All right, this is taking a look at baseline static and post-static balance performance. And one of the really interesting things, and this was published by Adam Gonzalez, who's at the University of Hofstra, is that resistance training was able to improve balance in these subjects. So another benefit of resistance training was not only improving the strength and size of these folks, it was able to improve balance for these older adults as well. We also showed one of the things that really was interesting is we used NeuroTracker and Dynavision to assess cognitive function and tracking skills, looking at spatial awareness. And the 6 weeks of resistance training also seemed to be a potent stimulus of enhancing tracking, spatial awareness, and reaction time in these individuals. So we did conclude, this study was published by Marin Fragala, this was cognitive function was an effective, the resistance training was an effective treatment option to potentially prevent age-related cognitive decline or dementia in older adults. And this is taking a look at the individual scores related to changes in spatial awareness. This is the exercise group. So we do see the changes that we saw here. These are the delta scores, whereas the control group, they're more of a spread of those that didn't change versus those that did. Here we see a positive response in those individuals that performed the resistance exercise, and these changes were significantly different. Taking a look at some of the functional performance skills, again, with the size here, we looked at magnitude-based differences. We can get up and go. Very interesting measure. Get somebody get out of a chair, see how quickly they can move. That was very likely improved. The gait analysis was very likely improved. The sit to stand was most likely improved, as well as the muscle quality index also was most likely improved. So this 2 day per week, 6 week study was very effective of improving strength, size, spatial awareness, reaction capability, balance, as well as some of these other functional performance measures. We then were also very interested in what was going on in some certain biomarkers. Due to the issues related to functional performance assessments, the variability that we see from study to study, the International Working Group on Sarcopenia had suggested that circulating biomarkers may be a better or an alternative and formatively clinically relevant or feasible measure of skeletal muscle quality which is objectable. So we actually were very interested in taking a look at two markers, N-terminal propeptide of type 3 collagen and C-terminal agrin fragment in relation to muscle remodeling, neuromuscular junction remodeling during this training program. Now, the N-terminal propeptide, P3MP, is part of the framework of the muscle. It comprised of collagen protein, and it provides the support of the alignment and growth of myoblasts. This type 3 collagen is located in skeletal muscles and synthesized in a large pro-collagen 3 molecule, and it's cleaved through the N and C-terminal peptide ends. During its synthesis, the N-terminal propeptide, P3MP, is what we can measure, is cleaved and released into circulation, and that's what we can actually measure. And what is thought by a study by Shally-Basine in 2009, that changes in P3MP in the circulation may reflect the anabolic changes going about in the muscle. In addition, the C-terminal agrin fragment is also another potential biomarker that's found in the circulation. In healthy muscle, neuromuscular junctions are maintained by the nerve-derived protein agrin. During neuromuscular remodeling, it's cleaved, the agrin molecule is cleaved by the enzyme neurotrypsin, and this cleavage, we can actually measure the calf, the cleavage of agrin into a calf leads into the functional disintegration of the neuromuscular junction. In humans, changes in serum concentrations of calf have been reported to be inversely related to appendicular lean mass in men, and so it's thought that calf could be a very potential marker of neuromuscular junction remodeling. So we take a look at these two markers in response to the exercise. This is looking at circulating calf to the resistance training program, pre and post training in the exercise and control model. As you can see, no differences were seen in calf pre to post exercise in the control group. So significant elevations were noted, about a 10% increase in the exercise group with only a 0.3% change in the control group. This was likely beneficial using magnitude-based inferences. In examining the circulating P3MP, the exercise group had a 7.9% change, whereas the control group only a 1.9% change, and the magnitude-based inferences only suggested that the changes were unclear. But as clearly, the calf response was very positive. Interestingly, when we take a look at the relationship between baseline, the change in calf, and the change in the cross-sectional area of the vastus lateralis, we did see a positive correlation between changes in calf and change in the cross-sectional area of the vastus lateralis, and as well as P3MP, we showed a positive relationship between the change in circulating P3MP from baseline levels to changes in lean body mass in all participants. So we do see the positive benefits of using these two potential biomarkers discussing the anabolic effects of training programs in older adults. I'm now going to very quickly go into some of our research using nutrient intervention in older adults. Well, if we provide protein and we perform resistance training, both are very potent stimulators of protein synthesis, we actually have a chance of really maintaining or increasing protein synthesis and maintaining muscle size and strength in humans, especially in older adults. In terms of the creep-left question, the use of powerlifting in older adults is clearly an example of that. There's a very big masters competition every year in the United States regarding older adults and Olympic lifting, these type of power exercises. The amount of protein and the distribution is key to preventing muscle mass loss with inactivity and or aging. If we take a look at the importance of that and how, as one ages, the risk for having low protein intake and its effect on muscle mass is seen, this is in healthy young individuals with 28 days of inactivity, we see a 2% loss in total lean leg mass. Contrast to that, in older adults with 10 days of activity, we have a 10% decrease in total lean leg mass. Total lean leg mass. There's a 3 times more muscle loss in 1/3 the time. For an older adult that has a decrease in protein intake, the risk of decreasing muscle mass is far greater than it is in younger adults. So maintaining appropriate protein intakes becomes critical in older adults. Real quickly, regarding supplementation, leucine, the branched amino acid, is critical in terms of enhancing protein synthesis. And HMB is an interesting compound. It's a metabolite of leucine. And we've done a lot of work in our lab looking at HMB as a potential intervention for both many different populations, young athletic populations, looking at recovery from exercise, looked at it in soldiers and preventing issues related to inflammation and muscle wasting during high-intensity exercise. And we've also looked at it in older adults and its effect of maintaining muscle mass, improving protein synthesis in older adults. One of the benefits of HMB in contrast to leucine, leucine is very effective of increasing protein synthesis. Unbelievable, increase of protein synthesis through mTOR pathway about 110% with no change in muscle protein breakdown. The benefit of HMB is that as a metabolite of leucine, is that not only does it enhance protein synthesis, it also has a major role in attenuating protein degradation as well. And this may be extremely important in situations where there's a balance between protein synthesis and protein degradation. The use of a supplement such as HMB may actually not only enhance protein synthesis, but also may minimize protein degradation. Really quickly through a study, we took a look at the effect of HMB calcium in this calcium salt in a older adult population. And just get to some of the significance. After 12 weeks, we were able to show significant improvements in body mass, lean body mass, knee extensor strength at both 60 at slow and faster speeds of contraction. But we also showed significant improvements, significant interactions in the muscle quality at the faster speeds of contractions in the groups that took HMB but didn't train. Where we then gave HMB and performed the resistance training program, the results are quite interesting. The benefits of resistance training and combined with HMB were even greater. Significant improvements were seen in strength. Also, significant improvements were seen in hand grip strength from baseline at both mid and post tests of both groups, but no difference between the groups. And the get up and go time was significant decrease from baseline to mid for both groups with no difference between testing. However, when we take a look at the muscle quality, we did see significant interactions between the groups. When we take a look at abdominal fat, the group that did the resistance training and provided HMB had significant reductions of abdominal fat compared to the other groups. And then what happens if you take HMB throughout a lifetime? In this particular study, using an animal model, significant decreases in lean body mass was seen after 86 and 102 weeks of no supplementation. In the animals that were provided provided HMB, there was no HMB provided in that group from week 44 to week 86, hence a significant decrease in longitudinal lean body mass. But when provided HMB from week 86 to 102 weeks, a significant increase was seen from the group that had low body mass to 102 weeks, had a significant increase in lean body mass. So the benefit of that is seen in animal models, quite interesting. We also took a look at this in beta-alanine, and we also showed positive effects with a combination, looking at two different doses, using just a protein supplement. This was Ensure. This was a grant funded by Abbott Nutrition. We looked at protein only, protein plus 800 milligrams of beta-alanine, and protein plus 1,200 milligrams of beta-alanine. And the most interesting effects of this we were able to see with the high-dose beta-alanine, 1,200 milligrams per day. We were able to see significant improvements in fatigue in both groups, 800 and 1,200 milligrams in the work capacity test, showing that we were able to delay fatigue in groups that were taking beta-alanine, and also the sit to stand was also significantly improved in the group that took beta-alanine and the protein. I'm sorry I can't get into the physiology of beta-alanine just due to time constraint. We also improved muscle quality hand grip at the higher muscle quality was improved through hand grip strength at the 1,200 milligrams per day. So in summary, resistance exercise will reverse muscle mass and functional loss with age. Potential caveats, obviously with working with an older population, is adherence to high-intensity resistance exercise programs, and frail elderly, resistance exercise may not be adequate to reverse the loss of muscle function. That's important to understand. It may become a time where it may be too late. The importance of starting at middle age or younger, as we discussed earlier. The importance of protein intake, whether it be leucine, HMB, or whole protein. Nutrition and exercise have synergistic effects. More research, though, is still needed in this particular area. And then my team at UCF. Thanks so much. Sorry for that.